lady's diagnosis bringing fresh concerns around the country about a second wave of the China virus. We're now joined by Dr. Zuhdi Jasser. He's a former lieutenant commander in the United States Navy Medical Corps and the former president of the Arizona Medical Association. We're hoping to be joined in moments by Dr. John Campbell. He's founder of Campbell Teaching, an online medical teaching resource. Dr. Jasser, thank you for being here right off the bat. And right now, at least initially, the president and first lady were showing mild symptoms, although we're getting reports from varying sources that the president's heading to Walter Reed. But even though the president is, he's in that at-risk age bracket, should people have elevated concern tonight any more than they already had?
I don't think so. There's a couple really good signs, except for his age and BMI, which is being mildly or moderately obese. The bottom line is he has no chronic medical conditions that would make him immunocompromised, that would make him specifically susceptible, no diabetes, heart failure, emphysema, all the things that end up are really often correlated with patients ending up either in the ICU or with significant respiratory compromise, number one. Number two, you have to note that he was tested positive before he had any significant symptoms. So if you look at the trajectory of the illness, most of the times people develop symptoms first and then they get tested. Now, granted, he's got, some of the best care on the planet around him, so therefore he's getting more aggressively tested. But having said that, he was positive before he had significant symptoms, so he's already through. His body's developing, the virus is inside him, but yet he has mild symptoms, so the trajectory looks good so far. But, yes, I heard he was on his way to Walter Reed. That's where I did my training 20 years ago, and I can tell you that often, especially with folks as busy as the president, they'll put him inpatient and just be able to get CAT scans and other things that you just can't do at the White House. So it should not be significantly alarming at this time.
I see. Yeah. And of course, the natural inclination for most people, hey, going to Walter Reed, going to the hospital, it could be serious, but that's actually good that you were able to get that out there. Now, look, I'm curious if, of course, I'm always optimistic. So when the president pulls through this and he starts detailing the regimen that he went through, and I imagine it's going to be what you and I have heard, hydroxychloroquine. Now we've even got the World Health Organization on board with steroids as being effective. Budesonide, which is an inhaled steroid, ivermectin maybe, and maybe the Z-Pak and zinc. If he goes through that regimen, let me just ask you as a medical doctor, what is that going to do with all this emphasis for the brand spanking new drugs like remdesivir and others?
Yeah, I think, bottom line is I think his doc, Connolly, already released an update on what his treatment is, and he's getting what is equivalent of convalescent plasma, which includes a company, Regneron, that put out synthetic antibodies, if you will, that are similar. And we see patients across this country getting that for treatment of or prevention of COVID. So you're right. I think everybody's going to be looking and seeing what our president gets for treatment and saying that must be standard of care. Bottom line is I don't think he's getting anything beyond what we've seen patients getting across in our own state here in Arizona or across the country in patients that might be part of trials or not part of trials, getting convalescent treatments with antibodies, et cetera.
Dr. Campbell, founder of the Campbell Teaching and online medical teaching resource. We were able to make a connection with him. Sir, thank you for joining us. So let me get you, first off, over there in the UK, the prime minister over there, he had the China virus, and he had a rough go of it for a while. Judging by what he went through and what you're observing, the president and the first lady are going through in the initial onset. Give us your observations, sir.
It is a bit of deja vu, actually. You get the same feeling all over again because, of course, Carrie Symonds, the Prime Minister's partner, was also infected at the same time he was, just as the First Lady Melania is infected at the same time as President Trump. Now, it was actually way back on the 27th of March, quite early on in this pandemic, that Boris Johnson was infected. And his course of illness is quite interesting because he was actually quite well for about 9 days, working from home, working through his prime ministerial duties, doing all the things he would normally do, talking to people, all online, of course. But then after 9 days, his condition deteriorated quite sharply and he was admitted to hospital. So that was really quite a shock for the nation, and people were quite traumatized by that. Then he was in hospital just for a day, and his condition deteriorated further, and he was actually moved into intensive care, and he was there for a 3-day period. Now, during that time, we believe he was given quite a lot of oxygen, but he wasn't actually mechanically ventilated. But it was really quite a concerning time. And after that, he said, well, it could have gone either way. You know, he was saying it was 50-50. You know, he was making it quite clear there was a risk that he could have died from that infection. Of course, the treatments weren't as advanced and sophisticated as they are now. So he was there for 3 days. And then when he got out of hospital a day or two after that, he actually took 15 days convalescence. He was too tired to do his duties for a full 15 days after that. So he was actually out of commission from the 27th of March all the way through to the 27th of April. And even for a few weeks after that, I felt he looked a bit tired. So this is a variable illness. Quite a long course in Boris Johnson's case, and of course a month's a long time in American politics, especially in the current month that we're talking about.
Yeah, no kidding. That is for sure. Coming off the trail, it's kind of an odd juxtaposition. Today, Mr. Biden was out on the campaign trail while the president was inside the White House. But as you saw what Mr. Johnson went through, and you're watching what the president is going through, as Dr. Jasser was observing earlier, he might have a sufficient viral load. He may have what 99.9% of the patients around the world have, which is a mild case. It's entirely possible, isn't it?
Well, it's not quite as high as 99%. At the age of 75, a recent meta-analysis has shown that there's around about a 4% chance of case fatality, actually. You know, this is a serious condition at his age. He's slightly overweight. His diet's probably not quite as good as it could be. But there again, he's quite fit. He plays golf. He's a complete non-smoker. He's a complete non-drinker. He's got very good medical surveillance. So he's got things for him and things against him. But the main things going against him is slightly overweight. He's a fair bit overweight, to be quite honest. He's male and his age is 74. So that is going to increase his chances. There is a 4 or 5% case infection fatality rate. But of course, that means there's a 96% chance he's going to make a good recovery. But I do suspect it's going to take time, given that he's symptomatic already. Even though he's been taken to hospital, but apparently for completely precautionary reasons, which of course is good and understandable. It still means he might have a reasonably high viral load, and it might take him quite some time to recover from this. So even though I would expect him, the balance of probability is that he will make a full comprehensive recovery and be back to perfectly normal duties. This can take some time. Same as if you get influenza or any other virus yourself like that. You know, you can be ill for quite a long time. You feel really ill, but then it can take a good few weeks before you want to go out jogging again or doing anything energetic again. And I wouldn't be surprised if Mr. Trump follows exactly the same trajectory as that.
Doctors Jasser and Campbell, gentlemen, I appreciate the time and the expertise here in the Chris Salcedo Show. Folks, be right back. We have more news to cover.